Getting towards the definitive diagnosis, it is very important that you have the imaging techniques at your hand, and only then you can have the definitive diagnosis whether the patient is suffering from some sort of a degenerative disorder, or either you're dealing with an inflammatory condition, or either there are chances that the patient might be suffering from any sort of a benign or a cancerous or a metastatic or tumorous condition as well. So all of these can be ruled out, and even you can have the different scanning techniques such as the contrast enhanced scanning techniques, as shown over here in a 71-year-old and a 64-year-old patient who is suffering from Alzheimer's disease, and 71-year-old patient who is suffering from Huntington's chorea. So all of these diagnoses, the degenerative conditions or the autoimmune disorders, are basically made upon all of these computed tomography scanning techniques that are enhancing and giving you the exact evidence towards the disease. Over here, you can even see there is the cerebral atrophy that is noted down just surrounding the ventricles. These are the lateral ventricles that are shown, and we have a kind of a deposition that can be even suggestive of a deposition, and it can be even suggestive of a kind of an atrophic condition that the brain might be suffering from. Then we can have, you must be well versed with the condition that basically you can ask for axial as well as coronal sections, and they're equally good for the diagnosis because you want to focus on any sort of pressure symptoms that the tumorous conditions might be exhibiting, or it can be even the pressure symptoms exhibited by the normal dose hydrocephalus, because we even suggested this fact that people suffering from dementia are sometimes suffering from a condition which is mimicking a normal levels of hydrocephalus, in which the CSF pressure is quite normal, but still it's mimicking a condition of hydrocephalus. So you can rule out all of these conditions on these imaging techniques that you can resort to. It's again a patient control subject and a comparative study of a control subject with a patient suffering from Alzheimer's disease. So the mainstay of the investigations would be the radioimaging techniques, because that is going to tell you the exact picture or the exact underlying condition that the patient is suffering from, and you can eventually basically make a definitive diagnosis. Either you're dealing with a tumorous condition, an inflammatory condition, or it is just a degenerative disease that you're dealing with. The prognostic factors are quite different, and even the treatment and the management plans would be differing whatever the diagnosis is.